Tuesdays, it's time to be with Dr. Bob Oliveri from Oliveri Chiropractic. How are you today?
Hi, Phil. How are you?
All right. I know you told me you're very excited about the topic we're going to be covering today. So could you tell us what it is?
Yeah, we're talking about advanced diagnostic testing and how to kind of get to the root cause of what your symptoms may be, whatever the condition may be. So, the whole key is really like investigative exploration to be able to find out what's really going wrong. When you go through a normal, let's just say a normal blood work, a normal CBC chem profile, and everything looks good and you still feel like garbage, what other underlying factors could be going on, and what other testing can be done that actually will help you find out really what the problem is?
I think this would be really interesting to people because everybody's into the NCIS and these cop shows where you're trying to investigate and find out what's going on, and all the different tests, all the different exploration and tests and so forth that they go through.
That is exactly what functional medicine is. That is exactly what the protocols, no matter what functional medicine practitioner you are, whether it's in endocrinology or OBGYN or pediatrics, whatever you are, that's what you do. You try to get to the root cause of why somebody is having a symptom that you're used to treating. And, you can always take something to try to mask the symptoms or take something to alter blood chemistry. But what's the root cause of causing all this? So you have to dig deeper, and it's a lot of work. It's not easy. It's not just getting that CBC and chem profile and looking at it and say, oh, cholesterol's high. Here's a medication for cholesterol to drive it down. Why is the cholesterol high? Why are some of the other factors that point that being high? And so what's breaking down in your metabolism? So the first test we're going to talk about is organic acid testing. And organic acid testing is absolutely fascinating to me because what it really does is, and you may not have ever heard this before, okay? I mean,
I can't say that I have. Organic acid?
Organic acid testing. And very, very, very rarely have I heard anybody ever mention this. I've never had a single patient that goes even through our functional medicine program that has ever even brought in an organic acid test to have evaluated, even if they've been to other functional medicine practitioners.
Because I know I learned in school that there's like acids and bases and there's certain pH levels, and I guess your body has to be in tune with that as well.
Exactly. What happens with this is, when you take your car in to go get tested,
right,
there's an emissions test that you'll get when you get it inspected. So what they'll do is they'll have a sensor that goes into the tailpipe, and it'll evaluate different things that are going on within your car. What's going on within the carburetor, what's going on in the engine, how is the oil being used properly. It just gives you a tremendous amount of information on the efficiency of the car. You think something that's that simple, how can it provide you? But it allows you to whether you're going to get, whether you're going to pass inspection or not, right?
Exactly.
Just that one little test. Well, that's basically what an organic acid test is. It's an emissions test for your whole body. And so it's amazing because what it does is there's a lot of different categories, and we're going to cover some of these. But primarily what we're doing there is we're looking at, number one, your energy systems in your body, your Krebs cycle. That is the system that actually allows all energy to be produced in your body. It will tell you how many ATPs, which are the energy producers for your body, how much is actually going to be given off during this energy cycle. And many different little factors come in. And we've all studied this thing called a Krebs cycle. I mean, we really have. Remember in high school biology or not, Krebs cycle was in there. And we all studied. I don't care what specialty you are in healthcare, we all study Krebs cycle. Most of us don't really do a whole lot with it once you do it, but you had to learn the energy cycles. You had to learn things where you're getting it from like glycolysis and electron transport and all these different things, gluconeogenesis, how your body will take certain nutrients and turn it into other sources for energy. Well, this actually looks at that cycle. It actually looks at it, and it will tell you what are some of the chemical elements inside there that really need to be increased in order for this entire energy cycle to work, because A is based upon B, which is based upon C, which is based upon D, and it goes all the way around.
Makes sense.
So a single breakdown in one product, in order for A to go to B, there's something that's involved there. In order for B to go to C, there's something that's involved there, whether it be an enzyme or something like that. Well, this will allow you to look at that. So it may be a step from D to E, maybe you're missing CoQ10 or something along those lines. So you need to add that to your nutritional supplementation to be able to allow this energy cycle to go. So it can be something as simple as that. So how crazy is that? If you're fatigued and worn out all day long, and there may be just one of these little pieces in that energy cycle that's going along that's missing, and you add it to it, it can totally change your life.
You're saying people don't get this test, or that very few people get this test, or do they get this test?
I can honestly say that I am the only person in Cape May County, Atlantic County, and Cumberland County that orders this on a routine basis for any of our advanced Feel Great and Eat. I've never seen anybody. There may be people out there doing it. Absolutely, there may be, but I'm not aware of anybody that's doing it. I've never had anybody come in for care that's ever brought it. And I have people bringing in piles of things from functional medicine specialists when some of these other tests we're going to talk about. But an oats test, an organic acid test, I don't see very often.
Organic acid oats. Okay.
Yep. We're going to get into more detail about what this test provides.
Interesting. Always learn something fascinating when Dr. Bob's here. If you have any questions and you want to find out more about Dr. Bob or his practice, it's Oliveri Chiropractic on Route 9 and Route 47 in Rio Grande. Phone number is 886-8585. That's 609-886-8585. More with Dr. Bob when we continue after some music here on 106.3 The Shore. 106. Tuesdays, we always spend with Dr. Bob Oliveri and learn a lot of stuff about what's going on with our bodies and how we can make ourselves feel better. Right, Dr. Bob?
That's what we're trying to do. We're trying to inform you a little bit more.
And today we're talking about advanced medical testing. And I got a quick question for you, if you don't mind. I've been involved in some of this stuff recently, and what the physicians always ask us is, has anything changed recently? Anything in your diet, any pills you're taking, anything that has changed in your lifestyle to maybe affect this change in your body?
Lots of times there'll be a single factor that you may have actually started adding to your diet, or maybe a medication that you started taking on your own. A lot of things that are over the counter. Lots of times you really should be by prescription, in my opinion. That can be, but usually what happens is you start to get like an immediate change from something that's been building up over a long period of time. Like if you have a tooth that's rotten out in your mouth for like 9 months, and it just hasn't hit the nerve yet, does it mean that tooth was healthy for the previous 9 months? No, it's just that you developed a symptom as a result of this slow decay. Coronary artery disease, that takes years to actually develop over a period of time, but your first symptom of that is a heart attack. So the problem is that we don't do a very good job with prevention in America. We really don't. There's not enough emphasis in our grade school and high school years to be able to talk about what is good food, how to eat properly, how to really kind of take care of ourselves. And as a result, our healthcare, is declining tremendous. We're 41st in the world in life expectancy.
41st?
And we spend more money on drugs than anybody else in the entire world times two.
Times two.
So it's like ridiculous. So if drugs are making you happy, we wouldn't be 40 or making you healthy. You're not 41st in life expectancy.
Right.
That it's not the answer. It really isn't. I believe functional medicine is the answer. I believe that teaching people a lifestyle of actually how you're supposed to eat, what good food is, how to prepare that food in how it actually tastes good to you. Get over the cravings. Forget the fast food, quick fix stuff, because really, honestly, it only takes another 3 minutes to actually prepare something, either out of a box or something that you're going to make fresh. So let's get back into a little bit about the organic acid testing here, because what this is going to do here is it's going to look at the three major, sources of energy in your body. It's going to look at fat, proteins, and carbohydrates, and it's going to see how they're metabolized. Just because something goes through your mouth does not mean that your body absorbs that and needs that. A great example of that is like calcium carbonate. For years and years and years and years and years, people were told to take calcium. Right. Well, the form of calcium carbonate is really seashells. It never breaks down in your body, and it's never absorbed. And I'm telling you right now, there are millions of people throughout the United States taking calcium carbonate, of which I can.
What's that? A supplement?
It's a supplement.
Okay.
So when they're told to take calcium, if you're getting advice from somebody that doesn't understand nutrition, has no degree in nutrition, they're going to give you really blanket answers like, take calcium, or take calcium and magnesium. But the source of calcium, the source of magnesium is just so incredibly important, whether it's bioavailable or not. So if you take a calcium carbonate, I can follow it on an x-ray. I can see it go in one end all the way out and out the other without ever breaking down. So just because you took it doesn't mean your body assimilates it into actually using it to where it's necessary. Well, that's also for our foods. If we go in and we take a protein through our mouth, okay, and we chew it up pretty good. It goes into our stomach, but our stomach doesn't have enough stomach acid to break it down. It never gets broken down into amino acids, which is the particles that it needs to be absorbed through your small intestines to be actually used as a source of energy and nutrition. So what this test does is it's going to look at all your carbohydrate metabolism, your fat metabolism, and your protein metabolism and seeing, is your body actually using it? Is it using it for the source of energy that it needs to do? It's also going to look at mitochondrial activity, which is the power source of every single cell in your body. It's the mitochondria that provides the energy for the cell. It's going to actually see, is it working properly? You need a lot of different types of B vitamins and many, many other things that you need to be able to fire the mitochondrial activity. It's going to be looking at intestinal microbial overgrowth. Bugs are a huge deal in your intestines. You got 30 feet of small intestines, and you have all these little fibers to absorb nutrients in there, and there's a lot of stuff that gets stuck in there. There's a lot of bacteria, there's a lot of viruses. I'm telling you, if I told you, they say between 18 to 22% of the population have parasites inside there, including intestinal worms. And you're like, there's no way in the world. I'm telling you, when we give some of this supplementation, when we find it in the genetic testing, the next one we're going to talk about, when we see it, you can clearly see 4 or 5 inch worms coming out.
4 or 5 inches
of you, absolutely,
oh my goodness,
positively.
Wow.
And it's abundant. These things hide under things called biofilms, and your body produces this, and they're very, very smart. But I'll tell you right now, the parasites and the worms, they wreak havoc on your immune system. Havoc.
I can imagine.
So,
and did you only get these from going like in faraway places, or can you get them if you just stay in this country?
When they serve sushi in this country, they serve it with ginger, and they serve it with what's the green stuff?
Soy?
No, it's the green stuff.
Like,
oh God, just the hot spicy stuff.
I can't think. I'm thinking hibachi, but that's not right.
It'll come to me in a second.
Yeah.
But they give that to you to be able to kill intentionally on the plate to be able to kill any parasites that are. You're eating raw fish.
Yeah.
Of course, that can be in anything. Of course, it doesn't matter whether it's farm raised or not. It does, but parasite. You're in your middle of the ocean. If you see a whale, what do you see? You see all these parasite little fishes. Trying to eat off of the skin and eat a bunch. They're in fish. So yes, of course, you can have a lot of that stuff in your body, and you're exposed to it. So no, it's not far away countries. It's in our diet right now.
Interesting.
So this is actually showing an awful lot of things. We'll get into some of the other things, but the mitochondrial markers are a big thing. Neurotransmitters. You can look at some of the brain function that goes on in this test. Are you following that? You can look at nutritional markers. A lot of different things. The B vitamins that are really important. The greatest anti-inflammatory known to man is glutathione. It looks at your glutathione portions of that. It looks at some of your detoxification pathways, how your body's actually getting rid of waste products, and a whole lot of other factors. But that's an organic acid test. That's one of the things that is one of the fundamentals of our Feel Great Nate Advanced program, to be able to find out what are your deficiencies and what systems aren't working, so we can actually back those and support those and get your body working the way it's supposed to be going.
We're speaking with Dr. Bob Oliveri. We do this every Tuesday. You can reach him at his office at 609-886-8585. We'll have more with Dr. Bob when we continue here on 106.3 The Shore. 106. Phil Pizza here along with Dr. Bob Oliveri, as we do every Tuesday. We're talking about advanced diagnostic testing. And Dr. Bob kind of creeped me out with the amount of parasites that could be in our systems. Unbelievable, huh?
Sure, absolutely.
Wow.
You have to look. I mean, that's really kind of the key. We're going to talk about that test in a second, but I just want to talk a little bit about some of this organic acid testing and where it comes into play. As you know, I kind of like live and breathe this, right? So I was up this morning at 4:30 in the morning, working on 2 of my clients that are patients, and so when we go and we look at somebody, and a lot of people that are doing this are really, really searching for answers. A lot of these people are really kind of sick. I mean, like really, really, really sick. And so one of my patients had a gastric bypass. So ever since she had that, she fluctuated in weight an awful lot. She had her gastric bypass, and when she did that, she lost 160 pounds. Okay, wow. That's not really designed to do that. Okay, so they actually then had to put her into an institution for eating disorder afterward. So that created like havoc on her body. And so what happens is, when we started going through all this stuff, you have to realize that when you go through a gastric bypass, you're bypassing a stomach that has a purpose, right? There's a reason for that. And I will say, in every single attempt when somebody goes through a gastric bypass, because, yes, absolutely, it makes your blood work look all good and makes your markers look really good. And in some people, that's, they're going to die if they don't go through it. I'm not going to tell you that I'm a fan of that. I'd rather see like a sleeve or something that can be removed. But
right. Does it bypass the stomach or just reduce the size of the stomach? Or there's two different operations?
Yeah, there's multiple operations, but a bypass really actually bypasses the stomach.
Wow.
Goes right past the stomach.
Okay.
So what happens with that is, and you can get some stapling, you can get a sleeve, to narrow the lumen so you don't need as much, and all those other types of things, So, I don't want to. This show's not about that. Right. I can talk 5 hours about that.
I'm just trying to understand.
And honestly, there are some people, that like, even though as a functional medicine, this is heresy to say, I think there are some people that really need to go through it because they're going to die if they don't have something, an intervention like that, because they have zero willpower. Here's the problem with just say bypassing the stomach, or stapling up, making it smaller so it lessens the function of it. There's a purpose for your stomach, and there's multiple things that are that it has a purpose for. But the primary thing is to actually secrete enough hydrochloric acid to break down your proteins. So if you have three elements to stay alive: carbohydrates, proteins, and fats, and that's the major things that you're having, for your food sources, along with your, of course, your minerals and things that go along with that. If that's what you really have, and you bypass one of those particular things, I understand that part of the procedures when you're going through that is to really, really give the person a very, very good understanding about nutrition following that. Because the supplement for that, what they'll do is they'll give them some protein drinks that are already almost basically pre-digested, so they don't have to be broken down into the smaller particles. And that's, and that's really good. And the intention there is good, and the thought process is good. But how many of us know people that have gone through that? And number one, they're just as heavy or almost as heavy as they were before, number one. Number two, they just didn't stay on the diet, because going through like, a week or two or three, or I'm not sure how long it is, but prior to that procedure of telling people, yes, you need to continually take proteins in and blah, 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 6 months out, there's not a continual follow-up on that. You really just need to be able to do that. So what this does, and this particular person had no energy, could just about get out of bed in the morning, because as a result of that, she looks good. She lost some weight. She lost a lot of weight, but had no energy whatsoever. And now she's turned into a new girl. And because of the fact that you do this type of test, you get a chance to see what are some of the things that she needs to increase her energy cycles from her mitochondria thing, how to supplement protein in a different way for her, how to try to get her back into those types of things. And so it's kind of, that's just like one case. I can tell you multiple, serious cases of these things. But the case I worked on today was exciting, because I got exciting news now on something I can present with her, that I'm going to be presenting with her in the near future, of how we can actually take that system and kind of like boost it up. Now, in the second test we're looking at is this GI map, which is, it's a DNA stool analysis. It's not just like looking for things under a microscope, but we can actually look at the DNA. We're looking for bacterial pathogens, parasitic pathogens, viral pathogens inside there. We look at the normal bacteria in your stomach, which you really need to have that. That's right. Why you take probiotics. Mm-hmm. We look for things like H. pylori, that is 99% of the time why you're getting gastric reflux, and you're getting all those things. It's a bacterial infection that nobody ever really looks for. They just give you, Tagamet or Pepcid or some type of protein pump inhibitor that's going to lessen the acid, which is nonsensical if it's a bacterial infection, right? But that's what's done. We look for opportunistic bacteria inside there. We look for yeast and fungus. We look for viruses inside there, parasites, intestinal health. We get a chance to see if your gut is inflamed. Because if it is inflamed, because that, as you will hear me say a bazillion times on this show,
yes, sir.
Inflammation is the cause of chronic disease. Mm-hmm. And you can look at it in multiple areas for inflammation. And you want to look at it in your blood. You want to look at it in your urine. You want to look for it in your stool. You want to look for it in every marker that you can possibly find. And if you get it, you better attack that. The course of this is all of these things I just mentioned, they're the sources of inflammation. Every single one of these things. If you have a parasite, that's inflammation. If you have a food antigen, that's inflammation. If you have a leaky gut, that's inflammation. So what does that cause? Everything. It causes coronary artery disease. Mm-hmm. It causes brain inflammation. It's causing all these chronic neurological problems. They're saying it's a source of Alzheimer's disease. It's a source of Crohn's disease, and it's a source of thyroid disease. It's all connected. It's all connected. If you come to a Feel Great Nate workshop, you're going to learn this. I'm going to show you PowerPoints that anybody can get. I don't care how uninformed you are. You'll get it. You'll go, oh, That makes sense. I don't care if you have a PhD in pharmacology. I don't care if you are an endocrinologist. They're all going to sit there and say, okay, that makes sense. We all studied this.
I've been there when I've seen the light bulb go on in your seminars when people see this information is presented to them and they relate it to their experience in life.
It's not rocket science, it's not. It's just investigation, exploring, and understanding what you're seeking. You know what I mean? It has nothing to do with how intelligent somebody is. You might have the smartest doctor in the world. You might have the smartest whatever in the world. It doesn't matter. You're only as smart as what you're exposed to in your education. Right? You're only that smart. I don't consider myself a great functional medicine practitioner. I consider myself a competent one. I work hard at it. I will tell you that. I'm going to a conference in Toronto for the next 3 days this weekend. I work hard at this. I work hard at it every single day. Like I said, I was up at 4:30 this morning.
4:30 this morning.
Do it all the time. I live and breathe it because you're changing people's lives. Our program's not very expensive. I'm not going to retire on this program. Believe me. I thank God each and every day I have an outstanding, amazing chiropractic practice that, we can get, sick people well, take care of their pain, and do things that I think is pretty cool. But this has been my passion. I want to get really sick people better. I'm going to try my best, in conjunction lots of times with their medical doctor. We need to have that. It's not like you don't need drugs. It's just that you need to work together to be able to go, I can provide some nutritional support and some investigative things that most people just don't have the time to do. Our program with this, is 8 months. And I'm going to be sitting down with you 12 times for an hour to really, who's doing that? Nobody's doing that anymore for a pittance of a fee. But it's kind of cool. So they're the two tests, and we're going to talk about another one in just a couple minutes.
In a few minutes, we'll talk about the other test. And again, fascinating stuff with Dr. Bob Oliveri from Oliveri Chiropractic. You can reach him at his office at 609-886-8585. We'll have more with Dr. Bob when we continue here on 106.3 The Shore. 6.3. Dr. Bob joins us every Tuesday here on the program. Today we're talking about diagnostic testing, advanced testing, and we're getting into some serious tests. I know I've never had these tests.
Sure. We were talking about organic acid testing, and we were talking about genetic markers for GI profiles, which are basically stools testing. Really seeing what's actually going on in your intestines, because honestly, that's where all the magic's happening. It really is. I mean, that's where your food absorption's taking place. That's where a lot of your good bacteria, bad bacteria live in there. So a lot of our health, I mean, the entire healthcare world in the last 10 years is looking to your intestinal tract for the source of your health. And why wouldn't you do that? That's where everything happens, right? That's where all your digestion, you can look at the heart, but who controls it? What controls, your energy system does. Your brain controls every single system in your body, but your intestines is where all the nutrients are absorbed so the rest of the body can do what it needs to get done. So it's a big area that's really kind of unexplored. There's a big difference between just going up there and taking a look and saying, I don't see any polyps,
right,
and actually understanding the physiology and actually what's happening at each and every one of those little microvilli and the absorption rate that's going on there and the breakdown of intestinal bonds, of zonulin including bonds, and where that inflammatory markers go. You shouldn't have to see inflammation. I mean, that's way down the line. By the time you're seeing it, there's a lot of breakdown that has occurred over a period of time. Before they call it celiac disease, there's a ton of brush border and microvilli destruction that's going on. And there's no microscope when you're in there looking, right? You're just grazing around, with a little tiny camera.
But Dr. Bob, you can't discount the colonoscopies because they do pick up,
Absolutely. I would positively not discount that.
Okay.
I'm just, my point is that there's a breakdown in your healthcare system way before you see a pathology.
Gotcha.
My God, you absolutely positively have to get colonoscopies.
So I know I'm due for one. I've had a couple. And
do
I'm
not miss
one.
that.
Yep.
Absolutely not. I love my GI guy. He's awesome. And I would never miss that. No, that's not what I'm saying. I want to make sure that I'm clear about that.
You're clear about that.
Okay.
Yeah,
absolutely. But you got to remember, you're not looking in your small intestine, right?
Right. Oh, that's right, because that's the large intestine.
That's only your large intestine, right? You're missing 30 feet with that scope.
Yeah,
There's a lot of stuff that goes, if they go down, they go through your mouth, they're stopping at your stomach, okay? And if they go up the other end, they're stopping at your large intestine, which, I don't hold me to this, is probably not much more than 4 feet. But that 30 feet of where all the things, and that's just the elimination area, but that 30 feet of where all the digestion's taking place and all the parasites live and all those other things, the only way you're looking at that is with stool samples. And if that's not part of your regular thing, and actually understanding how to look at them, there is a real science and art to looking at this stuff. I mean, this is actually additional schooling that we all get basics in school. I don't care what whether you're a chiropractor, osteopath, or medical doctor, you get the basics. But I mean, there's a lot of different things that you can pick up, and doing the genetic markers are really, really the big key to that. The old school was the O and P. You had to actually see an ovum or a parasite to be able to call it that. You had to look at it under a microscope. Now there's genes that you can test. Very cool. Very, very cool.
So what are the other tests that you wanted to mention?
Well, I had two more, but we're only going to talk about one.
Okay.
We'll just talk about the basic. We'll talk about a basic blood work. And when we get a CBC and a normal chem profile, they're pretty basic. That's what pretty much everybody gets. I like to add certain things to the test. I like to get a hemoglobin A1C, which is for your blood sugar. Most of the time that's done, but it's going to look at your blood sugar in a 3-month evaluation. Because if you don't fast properly, or you may have eaten really well for about 2 days or eaten really poorly for about 2 days, that blood sugar value is going to go up and down. And I'd hate to see somebody placed on a medication based upon a single value. So a hemoglobin A1C will give you the opportunity to actually look at how your blood sugar has been doing over a 3-month period of time. Ferritin is also another big marker for dealing with iron. It reflects the amount of iron stored within the cell itself. So you want to see, you can measure iron, but if you look at ferritin, you're actually its reflection. Has the iron gotten into the cell? Right? It doesn't matter that it's floating around in the blood. It doesn't. Is your body utilizing the iron? So I like ferritin as a great marker. It also does a lot of other it tells you a lot of other things, but I also order a more comprehensive thyroid panel. I always in an initial evaluation look for thyroid antibodies, because if you have a thyroid problem and you don't look for thyroid antibodies, you don't know whether that thyroid problem is coming from an autoimmune condition or whether it's just coming from a different pathway. Our last seminar that we had at Lucky Bones on Thursday was stellar. We had 46 people come. We had 39 people sign up for the program, which is pretty cool. And we explain these pathways. We talk about how it starts in the brain. We go through the hypothalamic pituitary thyroid axis. We get into how those thyroid hormones bind onto transport proteins. We talk about what can go wrong in each one of those things, and then whether it's actually being converted in the liver where it's supposed to be and in the kidneys, and whether it's being sent out to the cells and whether there's a problem with the cells. So we talk about all the different things that can go wrong and why one medication only covers one of those 8 different pathways. And so what are some of the things that you can do to address that? I think it was extremely informative seminar, and I'm very proud of it, because I think I finally feel got the point across. I mean, if we had that many people come and that many people understand it, it was really exciting for me. So some of the other things we want to look at, when you look at vitamin D, you want to look at both. But a lot of people don't like to order vitamin D because it's an expensive lab test and it costs. So usually they'll order 125-OH, which is the active form, which is really kind of cool. You want to do that. But you also want to look at 25-OH, which is the inactive form, because what it's going to do is it's going to tell you some of the kidney function. When the 125-OH is really for more of the autoimmune conditions that we look at. And it helps regulate calcium and phosphate in your blood and a bunch of other stuff. But vitamin D is extremely important to look at. And that the factor for normal, I don't have enough time to get into all this, but we're going to talk about values. And they're saying normal value is 40. If you're a functional medicine patient of mine, we're getting you up around 75 or 80.
Wow.
Because 40 is the minimum to be existing. We talk about some of the lab ranges and how they're actually different. One of the examples we talk about is glucose. If you go to our blood panel from LabCorp, normal lab ranges is 65 to 100. We try to get you in between 80 and 95. And that's a healthy range as opposed to an average range of which most people get when they go get blood work, which the average person that gets blood work is not healthy. And that's how blood values are derived, based upon averages within a region and not a standardization throughout the United States. Crazy, but that's the way it works. I'm kind of trying to jam a lot of information in here in a short period of time, but we'll talk about this maybe on another day on some of the blood work and some of the hormone testing, which is the other thing we're going to talk about.
What's coming up in your world? Anything this week that we need to know about?
Well, we don't have a seminar this week. We're still trying to recover from last week because I'm telling you, I was shocked how many people turned out. They're seeking answers. So it was really good.
Well, that's a good thing.
Our next Feel Great Nate is going to be on April 26th. It's going to be a Thursday, and it's going to be at our office. And because of the fact that since then we've probably had about 15 people call in saying that they had friends that went to the seminar and they wanted to know what the next one was going to be. We decided to do it. I was trying to change up topics. I was going to try to talk a little bit about fibromyalgia and multiple things, GI problems, celiacs, all that type of stuff, and do workshops on that periodically. But it just seems like people are very interested in the thyroid, so we're gonna do that again. And so we're gonna try to fill this need here, and then
the thyroid. Okay.
Yeah, so that's gonna be, call our office at 886-8585, and if you do sign up for this, you're gonna get a ton of information. I promise you, not just only at the seminar, but some of the stuff that we expose you to on our website.
Well, Dr. Bob, thanks for stopping by once again. Dr. Bob Oliveri from Oliveri Chiropractic, 609-886-8585. Give the office a call to sign up for that seminar. See you next week, Dr. Bob.
Thanks for having me on.
Next week, Dr. Bob.
Thanks.